All right, now we're moving on to platelets and the control of bleeding or blood clotting. Here are our outcomes, learning outcomes. So, hemostasis is the cessation of bleeding. So, blood stop, right? Hemostasis. And this involves our platelets. So, the platelets, they're not cells, they're rather small fragments of marrow cells called megakaryocytes. They're the second most abundant form of elements after erythrocytes. A normal platelet count in blood from a finger stick ranges from 130 to 400,000 platelets per microliter, averaging about 250,000. The platelet count can vary significantly under different physiological conditions and different blood samples taken from different spots of the body. So, in spite of their numbers, platelets are so small, 2 to 4 micrometers in size, that they contribute even less than white blood cells to the total blood volume. They have a complex internal structure that includes lysosomes, mitochondria, remember the powerhouse of the cell, microtubules, microfilaments, channels that open onto the platelet surface. They don't have a nucleus, and when activated, they form pseudopods and are capable of movement. So, pseudopods are little feet, right? Or fake feet, pseudo fake pods feet that allow them to move. And despite their small size, though, platelets have a variety of functions than any of the true blood cells. So they secrete vasoconstrictors, so chemicals that stimulate spasmodic constriction of broken vessels and help to reduce blood loss. They stick together to form temporary platelet plugs that can seal small breaks in injured blood vessels. They secrete procoagulants or clotting factors that promote the formation of blood clots that are going to be more durable than those platelet plugs. They initiate the formation of a clot dissolving enzyme that dissolves blood clots that have outlasted their usefulness. They secrete chemicals that attract neutrophils and monocytes to sites of inflammation in the immune response. They internalize and destroy bacteria. They secrete growth factors that stimulate mitosis and fibroblasts and smooth muscle and therefore help to maintain and repair blood vessels. So, really important, little guys. Here's a good pictorial of those, of their little pseudo feet, their little fake feet right there. All right, platelet production is a division of hematopoiesis called thrombopoiesis. So, a lot of poieses, as we talked about earlier. It's stimulated by a hormone from the liver and kidneys called thrombopoietin. Some hematopoietic stem cells develop receptors for thrombopoietin and under that influence become megakaryocytes instead of the megakaryocytes that we just talked about. So these blasts are cells that are committed to the platelet producing line. They duplicate the megakaryoblast, it duplicates its DNA repeatedly without going through nuclear or cytomatic division, as is normal in the cell cycle. And the result is that megakaryocyte that we just talked about. So a gigantic cell up to 150 micrometers in diameter, visible to the naked eye, with a huge nucleus and multiple sets of chromosomes. The megakaryocyte sprouts long tendrils called paraplatelets that protrude through the endothelium into the blood. And the blood flow shears off the proplatelets, which break up into the platelets as they travel into the bloodstream. And they can circulate freely for 5 to 6 days. 25 to 40% of these platelets as circulating freely are stored in the spleen. There are 3 hemostatic mechanisms. There are vascular spasms, platelet plug formation, and blood clotting, aka coagulation. The most immediate protection against blood loss is that vascular spasm, so a prompt constriction of the broken vessel. Several things can trigger this. An injury stimulates pain receptors. These directly innervate nearby blood vessels, cause them to constrict, and this can last only a few minutes. But other mechanisms take over by the time that it stops. So, injury to the smooth muscle of the blood vessel causes a longer lasting vasoconstriction, and platelets release serotonin, which is a chemical vasoconstrictor. So, the vascular spasms maintain long enough for the other two hemostatic mechanisms to come into play. And here's an image of that. So, platelets, they don't adhere to the endothelium that lines healthy blood vessels in the heart. The endothelium is normally very smooth and coated with prostacyclin. Sorry, that took me a second. Which is a platelet repellent. When the vessel is broken, however, the collagen fibers of its walls are exposed to the blood. So, upon contact with that collagen or other rough surfaces, platelets are going to grow long, spiny pseudopods, again, those fake feet that adhere to the vessels and to other platelets. So, the pseudopods are then going to contract and draw the walls of the vessels together. That mass of platelets thus formed is called the platelet plug that can reduce or stop minor bleeding. So the platelet plug is looser, more delicate than the blood clot to follow. And for this reason, the bleeding injury should be blotted with absorbent paper rather than wiped, right? So like a little paper cut, blot, don't wipe, to keep that platelet plug into place. As platelets aggregate, as they come together, they undergo degranulation, which is the exocytosis of cytoplasmic granules and factors that promote hemostasis. So among these include serotonin, which is that vasoconstrictor we talked about, ADP, which attracts more platelets to that area and stimulates their degranulation, and thromboxane A. And this promotes platelet aggregation, degranulation, and vasoconstriction. So instead of that negative feedback loop we were just talking about, this is going to be a positive feedback cycle that's activated that can quickly seal a small break in a blood vessel. So coagulation or blood clotting is the last but most effective defense against bleeding. It's important for blood to clot quickly when a vessel is broken, but it's equally important for it not to clot in the absence of vessel damage. You don't want your blood clotting if there is no cut, for example, because this delicate balance, coagulation is one of the most complex processes in the body, involving over 30 chemical reactions. It's presented here in this chapter in a very, very basic form, very simplified. Clotting's going to be best understood if we first consider its goal. So the objective is to convert the plasma protein fibrinogen into fibrin, which is a sticky protein that's going to stick to the walls of the vessel. So as blood cells and platelets arrive, they stick to the fibrin like insects in a spider web, essentially. And the resulting mass of fibrin, the blood cells and platelets, ideally seals the break in the blood vessel. The complexity of clotting lies in how the fibrin is actually formed. There are two reaction pathways to coagulation. One of them, the extrinsic mechanism, is initiated by clotting factors released by damaged blood vessels and perivascular tissues. The word extrinsic refers to the fact that these factors come from sources external to the blood itself. Blood may also clot, however, without these tissue factors, for example. Platelets adhere to a fatty plaque of atherosclerosis or to a test tube. The reaction pathway in this case is called the intrinsic mechanism because it uses only clotting factors found inside the blood itself. In most cases of bleeding, both extrinsic and intrinsic mechanisms are going to work together and interact with each other to achieve homeostasis. Clotting factors are called procoagulants in contrast to anticoagulants. Um, and most are always present in the plasma in inactive form, but when one factor is achieved, it functions as an enzyme that activates the next one in the pathway. Um, Eventually, the sequence is called a reaction cascade. Here are the pathways of coagulation and the reaction cascade in blood clotting. So once factor 10 is activated, the remaining events are identical in the intrinsic and extrinsic mechanism and are therefore called the common pathway. The activation of factor 10 leads to the production of prothrombin activator, an enzyme that converts prothrombin factor 2 to thrombin. Thrombin then converts fibrinogen into shorter strands of fibrin monomer, and these monomers then covalently bond to each other end to end and form long fibers of fibrin polymer. All of this is causing positive feedback. Thrombin also forms a prothrombin activator. So